do we recommend hormone replacement therapy?
Yeah, so the short answer is where warranted, yes. But I think it's worth defining that, of course. And our definition will differ from what most doctors, I think, would say.
Yeah.
This is not medical advice. This is just general health information, and should give you the tools to at least like question who you're working with if you're working with a doctor on it. But yes, of course I do, where it's warranted. Now, for men and women, that obviously looks different. For men, obviously we're talking about just testosterone replacement. None of the oral like pills like Clomid and clomiphene, they don't work. They create health risks that I recommend a man never take those drugs, unless there's some other reason besides hormone replacement to take them, but I'm not aware of any. So I believe like certain rare forms of cancer, but there are even other drugs that are safer from my understanding. So avoid those. Doctors that prescribe, especially hormone clinics, a lot of them are prescribing that. It's more profitable. That's honestly what I think they're mostly doing. And it's an easier sell because you tell a guy like, take a pill every day instead of taking shots, once a week, twice a week, 3 times a week. Because a lot of people are afraid of needles. They also do raise your sexual hormone binding globulin, which is the protein in your blood that binds to all of your sex hormones. In men, this is especially true of testosterone. And so that means that less of your testosterone that you are producing is free. So usually what you get is that you put a guy on this, regardless of the health, potential health consequences and risks, which include like permanent joint damage, permanent eye vision loss, and things like that. They usually feel good, a bit better as their testosterone raises, but then the sexual hormone binding globulin effect kicks in, and that rises, and so your free test ends up being, honestly, the blood work I've seen usually about the same. So yes, warranted, and where I'd say it's warranted is based on symptoms. Labs are for information purposes. They tell us like at a high level within orders of magnitude, like, yes, this is definitely a problem for this guy, or not, or the other answer is, or maybe it's a problem for this guy. I've seen guys that have had testosterone like over 500, where testosterone replacement was very warranted because they had high sexual hormone binding globulin, and their testosterone, they just had no free test. And so that can create he'll feel just as bad as the guy that might have like 100 testosterone or something like that. So, and a lot of doctors will ask questions before screening, like, oh, are you having testicular atrophy or things smaller? Have you lost body hair? Have you, you could kind of go down the gamut of like all the things, but really it comes down to energy level, motivation, muscle loss. Those are really the main things that we look for. Libido changes, that sort of thing. But honestly, like even those sexual changes are kind of the last thing to happen, the last thing to go. You'll usually be fine until you get like really low. And when that happens, that's when you know it's bad. And there is obviously concern about loss of fertility for men that are on testosterone. Everyone that I've worked with that has taken the proper peptides and protocols has been able to get their sperm count back up. So, even the FDA notes that it is not birth control. It's not reliable for that.
Yeah.
You can still be fertile on TRT even with a low count. So, it does not necessarily mean that you can't be fertile any longer. And for women, obviously it gets a bit more complex. We look for similar symptoms, just general loss of what I'd say like drive and energy. Women can get the brain fog that men get too, especially like short-term memory stuff, like forgetting names and stuff like that. And of course, like libido loss and those types of things. For women, how it's done and prescribed and the protocols can be a little bit more complicated because they've got testosterone, progesterone, and estrogen to consider. And sometimes all of those need to be replaced. Sometimes just 1 or 2 need to be replaced. In my experience, premenopausal women don't really need estrogen. You make plenty of estrogen, and taking testosterone doesn't shut you down. And so you don't get the fertility loss typically with hormone replacement with women unless you add a ton of progesterone, which you shouldn't be on, or estrogen, which generally you don't need anyway. You'll get some from the testosterone, but you'll also continue producing on your own. I've never seen a woman so far be actually suppressed by like the testosterone side of hormone replacement. And for postmenopausal women, sometimes estrogen is warranted. A lot of women, honestly, will get 90% of what they need off of just testosterone, maybe a little bit of progesterone. but it's not much. But I would say that some doctors, their version of hormone replacement looks like just estrogen pills, or even worse, just progesterone pills. Well, I don't say worse. It's different, bad, I guess. Generally what they need is testosterone. And a lot of doctors I've seen flat out tell clients and friends, women don't need testosterone. That is absolutely not true. The documented benefits they've been out there for a while, and the anecdotal evidence is very strong that women do need testosterone. It's just that they only need like a tenth of what men have, sometimes even less, and they'll do, and they'll do great. The doses are very, very small. The doses you administer tend to be very, sometimes even less than 10% of what you give a man. Pretty much always less than 10% of what you give a man for replacement, because they just seem to absorb well. And they have higher sexual hormone binding globulin, and that's sort of like a way to make a woman, I think, feel a little more stable with fluctuating hormones. I think it's just sort of like built into the system. So it's similar types of symptoms, I guess I would look for. And the first thing that I would usually turn to for a woman investigating this is like, where's your testosterone? And I will also say that it seems like when men's testosterone production is broken, it tends to stay broken. If you're low, you can probably do a lot of things to get it back up, but once you're past 30, you can probably not get it high again unless you were like morbidly obese, like very morbidly obese and had a terrible lifestyle, because it just seems like men are more products of their environment as it pertained to puberty and through like 20 or so, whereas women are more products of their present environment. So if you've been broken in the past, obviously there's some degrees of damage that could happen from hormonal birth control probably being the worst. And in both cases, actually, recreational street drugs too tend to cause a lot of damage, and certain antidepressants. But women actually can often get their testosterone levels to a pretty good level. Now, if you want the testosterone, you'll probably feel better with high testosterone for a woman. But you might not necessarily need it. Most women just will feel better on it, honestly. And I think it should be more of a norm where that's just a normal screening, especially once you're past like 30 or so. But I think it's good to actually get that baseline when you're younger, so you have an understanding of where you might be headed and where you're going and where you've come from as you age. And the standard practice, I think, should be for women, once you're postmenopausal, you basically should be on testosterone, at least by itself, perhaps the other two, but testosterone alone, because this is going to help with retaining bone mass and muscle mass and just that energy and things like that. A lot of women that are postmenopausal, their energy levels just take a dive. And it also is good for metabolic health. Like your ability to handle stress is a lot better, those types of things. And that's another symptom of low testosterone too, but like postmenopausal women really struggle with those types of things and motivation. And that's why. It's because you're basically postmenopausal, you're chemically castrated, or I could say genetically castrated. And for quality of life and sense of well-being, I think that should just be standard practice. Women are on, 3 to 10 milligrams of testosterone a week post-menopause. Once it's confirmed they're postmenopausal, like that should be general standard practice. And a lot of doctors are administering oral estrogen, which raises sexual hormone binding globulin, makes so the estrogen doesn't go as far anyway, and can include some of the things that you get from estrogen that are negative, especially in the absence of testosterone, like irritability and some of those types of things that you don't want to have. And also, when you have high estrogen in a woman or high progesterone without testosterone, or without testosterone being proportionately raised, you have a much higher risk of cervical and breast cancer. And that's why all of this is why if you look at mortality rates for women, their risk for metabolic disease, their risk for cardiovascular disease is way lower premenopausal than men. But post-menopause, it becomes equal to or greater than men. It is for this specific reason. You lose your hormones, you lose your basically a lot of ability to be protected against these types of diseases. There's even evidence that it can be helpful to prevent things like dementia and stuff like that. So I just think it should be standard practice, and honestly, same for men too. Your quality of life is just going to be better. It protects against a lot of health stuff, and even the FDA has recently admitted that there is zero cardiovascular risk introduced from testosterone, zero risk of any kind of cancer, including prostate, from TRT. The only real risk that it seems to sometimes have in some men is your blood can be a little bit thicker. This doesn't actually seem to correlate to an increased actual incidence of stroke from what I've seen, or heart complications. And I suspect that in many cases, these are men that were borderline had sleep apnea, and taking testosterone can make you have sleep apnea if you're borderline, because your neck will be thicker. And so that's just something that you should be aware of either way. But if you were borderline before, this will probably put you over the edge. And so something to be aware of, particularly for men, and that specifically leads to the blood thickening that I'm talking about.
Yeah, for sure. Yeah, I agree. I would only mention a couple other things. One is like for women, if you're a cycling or non-cycling woman anymore, something to look for in a provider if you decide you want to go the hormone route, is that they would add in one thing at a time and adjust them slowly. I've seen women get put on all three: testosterone, estrogen, progesterone, and they blow up like a balloon, or they have just all these symptoms start, whether they're histamine issues, mood swings, weird weight gain, weird inflammation. And then what you've done is you've introduced all these variables at different levels, and you don't know what lever to pull in order to reduce those symptoms. And so a good provider will start you on one thing, and it should not be estrogen, it should be testosterone or progesterone, and start you at a low dose and then work you up slowly. And then once you get that kind of dialed in, you can introduce something else if that provider chooses. But again, you might not need all of it. It depends. It really is individual and depends on symptoms and what stage of life you're in, and if you're cycling, if you're trying to preserve fertility, and there are a lot of factors to consider. So but anyway, a red flag for a provider for me would be putting you on multiple things at once, and any provider that insists on really high dosages, especially at first. I've seen that. Or
estrogen monotherapy.
Yeah, or estrogen monotherapy.
Almost never warranted.
Which would be estrogen only therapy. And there is a bit of a mantra in the like Boss Babe hormonal replacement space of like the higher levels the better, because we want to make you like a teenager again, because you can. Why not? Science.
Teenagers
right?
Don't have that high levels, by the way.
Oh yeah, I totally agree. So, but if that is the mentality of any sort of provider you're working with, that would also be a red flag for me. And also, if you are a cycling woman, like Justin mentioned, your hormones are going to be really, really reliant on diet, lifestyle, stress. And so a lot of the time, if you can get those things dialed in, your hormones profile and blood work and just how you feel will look a lot better. That means training. That means losing excess weight is a really big one. That means getting your digestion in a good place and drinking more water. That means getting you outside more. That means even timing your meals in a way that's helpful.
More water, more fiber, more protein, less fats.
Yeah, more training, and just what was the other thing I was going to mention? Oh yeah, also getting your insulin sensitivity in a good spot. Like all of those will affect your sex hormones. And so if you really are concerned about that, those are the things we need to get dialed in first, because the other thing that women are more sensitive to than men is putting hormone replacement therapy into a body that's already not healthy. That is asking for trouble in a lot of ways. And so even if you're someone who wants to get on hormone therapy, it's not a magic bullet that's going to fix the other health issues.
If you keep eating junk, if you all that, it doesn't replace all that. No. The way I like to describe it is hormone replacement is like a force multiplier on your habits.
Yes.
And absolutely. If you have bad habits, it actually can make things a bit worse.
Yes.
As far as your health goes, you might feel better, but your health might actually be worse.
Yes, for sure. Yeah, I can't emphasize that enough. And so even if you're someone that wants to go the hormones route, you actually still need to get healthy first and start working on those habits before you
can do. I mean, I'd say you can do both at the same time, but you have to be very aware that
you do
what your protocol is might change as your body changes.
Yes.
And along those lines, I find it usually takes like 6 months to figure out what a man's ideal hormone replacement looks like.
Yeah.
For women, it often takes like a year, because there's so many more variables, and you have to time it on her cycle and some of those types of things. So have that expectation that like sometimes you might even just feel worse during that year as you kind of figure things out.
Yeah, and there is a debate around hormone replacement for women both postmenopausal and if you're still cycling, and that's something you're going to have to do your research on or ask someone like us about further.
It's individual.
It is individual. It is
Yeah.
individual, and where you're at in life and what your goals are and what your family planning goals are and what your current health state is. Like Justin said, postmenopausal, I'd give it a green light, for at least testosterone for the majority of women, but even that can depend a little bit. So
Yeah, and one thing with women's fertility too, testosterone administration doesn't seem to mess with it. At replacement doses, not excessive doses, of course, which women shouldn't really do anyway. But especially oral estrogen administration, that is basically often birth control. And so if you're doing that, be aware that will probably make you infertile. And you probably I just think the whole oral estrogen thing needs to basically go away.
Yeah.
It's a lot of potential health complication. And I haven't seen it actually help anybody, to be honest.
Yeah, this is a very complex topic, as you can probably tell.
Yeah.
And so if you do
We could do a discussion on each, either sex, the individual hormones. I mean, it is a lot to unpack.
It is, yeah. So we just wanted to give kind of a flyby overview, but also just say we do in general recommend it, depending on the individual.
Yeah.
So that's how you could sum it up. And if you do have questions, we work with people on this actually all the time.
Yeah.
So please reach out to the High Calling page and book a consult or reach out to one of the coaches on social media, and we'd be happy to work with you.
Yeah, and we do have specialists, hormone replacement specialists we do work with that we can recommend you to work with if you want to, or you can work with the local provider. So as we can help advocate for the types of questions you can ask and things you can say to the right people as you screen providers and things like that. Yeah. My name is Justin Johnson with High Calling Fitness. Maybe you're tired, gaining weight, waking up with joint pain, back pain, and a body that just doesn't feel like it used to. You've tried to fix it, but nothing seems to last. What if you don't need another app or crash diet, but a real coach, someone to meet you where you're at and walk with you step by step? At High Calling Fitness, our coaching comes to you wherever you are. No matter where you live, small town or city, across the country or across the world, your health still matters. You don't have to go it alone. We build personalized plans based on your goals, your schedule, and your equipment, even if it's just a set of dumbbells in a small space. This isn't just training, it's a personal partnership. You'll get weekly updates, one-on-one access to your coach, and ongoing support through Zoom and Slack every step of the way. We're here to help you build strength, restore energy, and claim the life you were meant to live. Book a free consult today. Let's talk about your goals and see how we can build something better together. High Calling Fitness, built for the everyday, ready for the extraordinary.